Coronary bypass surgery. Definition: coronary bypass surgery is a procedure that restores the blood to your heart method by diverting the blood or bled around a section of the blood artery in your heart.
Heart bypass surgery creates a new route called a bypass for blood and oxygen to reach the heart. Heart bypass surgery begins with an incision in the chest, and the breastbone is cut, exposing the heart. Next, a portion of the saphenous vein, which is very large, is harvested from the inside of the leg. Pieces of this large vein are used to bypass the blocked coronary arteries, which are arteries that supply blood to the heart. The venous graft is sewn to the aorta, the main artery of the body, and to the affected coronary artery to bypass the blocked site. The internal mammary artery from the chest may also be used to bypass a clogged artery. Several arteries may be bypassed depending on the condition of the heart. After the graft is created, the breastbone and chest are closed.
Application in nursing. Connect the patient to the ventilator that shaped the about long field arc ventilator. Connect electrode of the ICU monitor for electrocardiography recording. Connect the pressure capsule to the monitor modules and calibrate them. Connect the kit vent to the patient's central venous catheter. Control of vital site.
A coronary artery bypass graft, or CABG, is performed to improve circulation to the heart muscle in people with severe coronary artery disease. In this procedure, a healthy artery or vein from another part of the body is connected or grafted to the blocked coronary artery. The grafted artery or vein bypasses the blocked portion of the coronary artery, carrying oxygen-rich blood to the heart muscle. One or more coronary arteries may be bypassed during a single operation. Before the surgery, an intravenous line will be started, and you may be given a medication to help you relax. CABG procedures are done under general anesthesia, which will put you to sleep for the duration of the operation. A breathing tube will be inserted through your mouth and into your throat to help you breathe. A catheter will be placed in your bladder to drain your urine. Coronary artery bypass surgery generally takes 3 to 6 hours. During a conventional bypass surgery, your surgeon begins by making an incision in the skin over your breastbone or sternum. He or she will then cut the sternum and move your rib cage in order to get to your heart. Throughout the procedure, your circulatory system will be connected to a cardiopulmonary bypass pump, or heart-lung machine. This machine temporarily performs the functions of your heart and lungs during the surgery, allowing your heart to be stopped while the surgeon sews the grafts into place. One of 2 blood vessels is typically used for the grafts: the internal thoracic artery in the chest, or the saphenous vein in the leg. For the internal thoracic artery graft, your surgeon will leave the upper end attached to the subclavian artery and divert the lower end from your chest wall to your coronary artery, just beyond the blockage.
Pros and cons. The bypass allows more blood and oxygen to flow to the heart muscle. Most people get excellent relief from angina and improved quality of life. Cons. Heart bypass surgery are different from person to person depending on the severity of heart disease, type of operation, age, and current state of health.
considering the risks of CABG, it's important to remember that bypass surgery has been performed for more than 30 years. It is the most frequently performed major surgery in the United States. Our cardiovascular surgeons have received extensive training in bypass techniques. As with any surgery, your health before surgery is a major consideration in determining your risks. Health conditions that should be considered before surgery are age. Patients over 70 are at a slightly higher risk for complications. Gender. Women have a slightly higher risk. Having another serious medical condition such as diabetes, peripheral vascular disease, kidney disease, or lung disease. Previous heart surgery also puts a person at a higher risk.
Issue apply in Ecuador. More recent studies have also showed a decrease in mortality rates despite the trend towards a warning risk provided. Furthermore, serious outcomes in older patients are usually shown not with studying the high risk inherent to this population.
Coronary artery disease is just one system manifestation of a systemic disease, atherosclerosis, arteriosclerosis. It's the accumulation of cholesterol plaque between the very inner and the middle layer of the artery, which gradually occludes the artery. It's just like there's a landslide across the river. You can tunnel out the landslide and reestablish the native riverbed, or you can go around the landslide and create a new riverbed. And that's what we do in coronary bypass surgery. You connect your conduit, vein or artery, to the native artery beyond the obstruction. Then if it's the chest wall artery, it's already got flow because it's connected. In the vein, then you have to bring the vein up to the aorta and make an incision or a small hole in the aorta and connect the vein to the aorta. Over 200,000 people a year approximately have this kind of operation, and our success rates are extremely high. The mortality rates from that are very, very low, less than 2% in most good institutions, and our hospital stays a lot less than they were 39 years ago when I first did this, 10 days to 2 weeks. Now it's somewhere between 2.5 and 4.5 days.
Conclusion: coronary artery bypass surgery is endorsed by the excellent, well-documented long-term results generally with complete revascularization and the use of one or two IM8 grafts. Success will depend the patient.
Coronary artery bypass surgery is, as the name suggests, when you get a blockage in your coronary vessel. To treat that, you have two possible ways. One is to put a stent and push that narrowing or stenosis open. Another option is to actually bypass it. And in coronary artery bypass surgery, what we do is we